one afternoon, Dr. Steele came up and asked me to make rounds with him, which was completely not something Dr. Steele normally would do, and told me he wanted me to come over to his office and talk with him the next day. And he proceeded to tell me all of his plans for the burn, building a burn unit and taking care of patients and having a burn line that was 24 hours, open for 24 hours, so he could take burns from all over the Southeast and South Carolina and Florida and Alabama. And he just had this grand idea of how he wanted to treat burns, and he asked me to come to work for him. So I started working for Dr. Steele on September the 1st, 1978.
When I first became affiliated with the hospital, I was 12 years old and was a junior volunteer. That led to being a patient assistant liaison and at 16 when I was employed with the hospital. During my time here at Doctors Hospital, I was not allowed to go into the burn unit. It was off limits for teenagers. So I then went to PA school, so of course the first place I wanted to go was to the burn unit. I wanted to go behind those doors. And quite frankly, after I entered the burn unit doors, I never wanted to leave.
With Dr. Steele, he created a passion that he had for taking care of his burn patients, and you were able to catch it. It was contagious. It wasn't that you liked burns, but you had a passion.
Dr. Mullins has really gotten behind that vision, and I think he's overseen it and he's pushed forward with what Dr. Steele wanted. Dr. Mullins, when he started here, I actually go all the way back when he was a PA student, and whoever would have thought that he would take over the burn unit and run it and create what he's created. But I just think this has just been a wonderful time. The fact that we've been here all of these years and we've grown and we've developed.
I think Dr. Mullins took what Dr. Steele had taught him and has taken it to an entirely new level.
Dr. Steele taught Dr. Mullins how to be a leader. They have a very similar personality and a very similar leadership style. But under the direction of Dr. Mullins, we not only provide care to the burn patients of the Southeast, we are now providing burn care to patients across the country. And without Dr. Mullins, this would not be possible. But I know that the foundation that Dr. Mullins received from Dr. Steele was just the beginning.
I would be able to go into the operating room with him to see firsthand how the burns were treated, and it was just absolutely amazing to watch this man who had just a passion for what he was doing.
Dr. Steele believed that a multidisciplinary team approach to the care of a burn patient was what would make this place successful. He thought that each individual provider should give their area of expertise to optimize the care of that burn patient. So when a burn patient comes in here, it's not just the beginning care that they receive, it's the whole continuum of care. Our goal is to heal the burn patient, provide them reconstruction, assist them with their rehabilitation needs, help them with scar management. He also felt that the family was a very important and integral part of a burn patient's recovery. So we implement those family members in their care very early on. It's important that the patient, all of their needs are met, not just the care of the skin.
One of the things that I have enjoyed the most about being here is the rapport that you get to establish, not only with the patient but with the family, because most of our patients are here for an extended length of time. And we've when I first started, I didn't understand like why we would take some of these patients and we would work so hard for their survival. But then after I worked here for a while and I started seeing miracle after miracle.
My heroes actually are my patients who have come through here with some of the most catastrophic injuries and yet have prevailed.
A 12-year-old who was standing next to a barrel and a paint can exploded and she sustained burns to her face, hands, arms, legs, and was in our burn center for several months. And I think the reason why she stands out in my mind so much is because when she was a teenager, she came and volunteered here at the hospital. So we took a burn patient and made them a volunteer. When she went to PA school, she became a PA student here at the burn center. So taking her into the operating room and teaching her how to do a skin graft that had been previously done on her was extremely challenging for me as a healthcare professional, but very rewarding.
There was one particular patient that came in and he was helping put in a septic line and they hit the high line. And when he came in, I remember asking Dr. Steele, you know, what are we doing here, Dr. Steele? And he said, it's not your choice to choose for these people whether they have a quality of life or not, and you never know how people are going to respond to tragedy. And this particular patient just made a liar out of all of us because he has just thrived. He wound up losing both of his legs, one of his arms. He is now able to paint. He's very active in the community. He has come back here several times to mentor some of our patients, and he's just, whenever you see him, he's smiling, he's happy, and I know in my heart we did the right thing.
I think what we have here at Doctors Hospital is extremely special, and to be able to spread that word and start mini centers, if you will, or to start burn centers that have some of the same foundation that we have here and the same quality of care is amazing.
It has just been absolutely an amazing privilege. And thanks to Dr. Mullins for allowing me to still continue to be here, because now I'm working on my next 40.